Hi guys, I'm Jordan and I'm a master esthetician here at Amara in Orem, and this is Jensen.
Hi guys!
And today we're going to be microneedling her face. So we've already kind of got her prepped. So we've cleansed her skin, we've pre-treated her, and she has numbing cream on her skin. She's had it on for about 30 minutes, kind of getting her nice and numbed up. And so we're just going to go right into the process. So if you have any questions as we're doing this, feel free to comment and we can kind of answer them as we go. So basically what microneedling is it's a collagen and treatment. It can be used for wrinkles, for fine lines, for acne scarring, for texture, things like that. So I'm putting hyaluronic acid on her skin, and the needles are going to help penetrate it really deep into her skin.
What does hyaluronic acid do?
Hyaluronic acid is a hydrator. So what it does is it holds 1,000 times its own weight in water. So any moisture that comes into your skin, it's what really holds it and keeps your skin nice and hydrated. So this is a good treatment for the winter too. So this pen right here, it has 12 needles in it. Okay, you ready? Mm-hmm. And they're going up and down. How'd that feel?
Okay.
Good?
Yeah.
Okay. Let me know if you want it turned down at all.
No, it's fine.
So the needles are going up and down, creating tiny little micro channels in Jensen's skin. And so that helps for the product to penetrate really deep. And then what it's doing is creating a controlled wound. And so our collagen and our elastin in the skin are working to kind of rebuild those little wounds, which in turn gives you plumper skin. It helps fill in those fine lines and wrinkles, acne scars, things like that. How you doing?
Good.
Okay.
The only weird part is just by the hairline.
Yep, up by that bone. It's
yeah.
a little tender, but it's not too bad, right?
No, not bad at all.
Okay, awesome. You're doing good. Okay, so we'll do 3 passes on your forehead. So you're gonna do 2 more.
Okay. So you go vertical and then horizontal?
And then diagonal, just to ensure that no spots get missed. Good job. That's the worst one up by that hairline. Good job. Okay, 1 more.
And then the little bleeding is normal, right?
Just a little pinpoint bleeding.
And then say the side effects, not the side effects, sorry, the benefits one more time.
So it's awesome for fine lines and wrinkles, just for plumping, like an overall plumpness of your skin, for skin texture. If you struggle with acne scarring, it's amazing. And you can do it in a series. For acne scarring, it's awesome in a series. And you can do it in conjunction with chemical pills. So on Jensen today, we're going to do a chemical pill with this. And so the chemical pill that we're going to do on her is specifically aimed at like lightening and brightening. So we're going to give her a nice plump. We're going to give her a nice lighten to kind of just give her a fresh winter skin. As everything is nice and dry outside. Okay, I'm going to have you kind of turn your head that way. Awesome. How's your forehead feeling?
Good.
Okay, we're going to move to your cheek.
Awesome.
In this area, you shouldn't feel too much. It's not as bony.
And how often do you recommend someone getting this treatment?
So it kind of depends on what you're looking to target. For me, I like to do it once a season as just kind of like maintenance. If you're looking to really treat like fine lines and wrinkles or acne scarring, you can do it in a series. You know, to do maybe 4 every 4 weeks or so. You can do them in opposites with like a chemical pill. Like you could come in, you could do a chemical pill, and then 2 weeks later you could do a microneedle. Just kind of depending on what you're wanting to target. Does that kind of answer that question?
This hasn't hurt at all.
Yeah, the cheeks are nice and easy.
That's good. Is the forehead probably the most painful part?
It's just those bony areas, you can just feel it a little bit more.
You want to just re-explain kind of what you're doing?
Yeah, so basically what I'm doing right now, for microneedling her cheek. So what we're doing is we're creating little microchannels, little controlled wounds, so that way her collagen and elastin kind of start working overtime to plump her skin, to kind of get rid of any like fine lines or wrinkles that she has. Does that kind of make sense? To help with pore size, things like that.
And then the name of the treatment?
Microneedling. Turn that way.
And can you only do microneedling on the face, or can you do it in other parts?
That's a good question. You can do it on other parts. It's awesome for stretch marks.
Oh.
That's a really popular one. But yeah, you can do it on lots of places. Any areas that you have scarring problems, like I said, stretch marks. And those are more, you'd be looking at more of like a series if you did something like that. You'd want to do those, you know, do a series of a couple, you know, every couple months or something, just to kind of really get an aggressive treatment. Because those are a little trickier to treat, but you can get really good results with microneedling for scars and stretch marks on the body.
And how often should I get this done?
It's kind of up to you.
Okay.
For you, what is your main goal with this?
I mean, just plump, fresh skin.
Fresh skin.
Yeah.
And then, I mean, I would do it, like I said, I do it once a season, and then I keep up on my chemical peels in between. But for you, you could do like one every other month, and then do a chemical peel every other month.
Okay.
Something like that. Okay, and then you'll notice that she's not bleeding quite as much on her cheeks.
Good.
So that's awesome. It's not good or bad if you bleed a lot or you don't bleed a lot. Everybody's different. But you can see the bonier areas, they'll bleed a lot more. The needles go to different depths depending on the areas in the face. So definitely on a bonier area, I keep the needles a little bit smaller and not going as deep into her skin, whereas on her cheeks there's no bone, so I can go a little deeper and she won't feel it and it won't harm anything.
I have a question.
Yes.
It says, can you do microneedling if you have done Botox as well?
Yes, you don't want to do them, so if you get Botox, you want to wait. It's the same as if you were to do a microdermabrasion or something like that. How does that feel?
That's fine.
Okay.
Yeah.
If you get your Botox, you want to wait, I'd say 2 weeks. Our nurses may have a different time frame that we can check in for you. But usually just a couple weeks just to let that Botox set. It's same with like any kind of, you don't want to move anything around that they've injected. I know it's pretty localized, but for the most part, just giving it a couple weeks to just set, and then you can totally do it. The only person who can't do microneedling, obviously if you're on Accutane, or pregnancy, just because of the numbing cream. That's the only reason that a pregnant woman couldn't do it. So if you want to go without numbing, you can, but most people don't want to do that.
This actually is not bad at all.
It's not too bad, huh?
It's just that hairline.
What does it kind of feel like to you?
Right here?
Mm-hmm.
It's kind of weird on the chin. I feel like it's like... I can't even explain it, honestly. It feels like a pulling. Like it's like, like a pinching, pulling feeling.
Sometimes it tickles a little bit. Okay, now we're going to move to your upper lip. Sometimes this is a little bit tender.
Okay.
Do you want to explain the controlled wounds part a little bit better?
So think about any wound in your body, basically. If you have a wound, your body works to heal it, right? So if we're making a small wound, it's not big enough that we're like damaging you or hurting you, but we're controlling it. We're making this small wound that your body is going to work to heal. And how it's going to work to heal it is your collagen and elastin are going to rush to it. And your collagen and elastin are what gives your skin like strength and bounce, basically. So the things that are going to help you look the plumpest and fill in those wrinkles and those lines, basically creating a little wound with these needles is just giving your body an excuse to heal itself and improve itself kind of in the same time, if that makes sense.
Because there's just like an overload of collagen in
Yep,
that area.
there's just an overload of collagen. And cells, they take on, I don't know how to word this, the memory kind of cells. So you have your skin, right? And it naturally turns over. As you get older, that process gets slower. So when you're young, that's why you have fresh baby skin. But as you get older, it takes longer to turn over, and that's why you deal with wrinkles and crepiness and kind of things like that. So basically, we're helping your cells remember how to turn over faster and how to be stronger.
What does my face look like right now? Is it bleeding?
Pretty
Yeah,
red.
you're a little bloody.
Oh, really?
Mm-hmm. You got a nice blood mustache right now.
Oh, nice. Super
It
cute.
looks like a sunburn
Oh, okay.
Yeah.
on camera.
That's better.
Yeah, it looks like a sunburn.
Better sunburn than bleeding.
Okay, so I'm gonna do your nose. When I do your nose, I'm gonna hold this side. It just makes you feel like you have to sneeze sometimes.
Okay.
So if you have to sneeze, just stop me. You can.
Okay.
But I'm just gonna hold that to make it feel less like you have to sneeze. Good job. Kind of weird, right? Good job. Your other side.
You're a true virgin.
Good job. Okay, I'm gonna come right up the middle.
Oh, whoa.
Good job. That's the worst one.
Oh my god. Just ugly laughing over here.
Okay, you're almost done. I'm gonna give you a little bit under the eyes.
Just water
And
a
then
little
do
bit.
you have, I know sometimes the nose makes you water a tiny bit. Do you have any specific areas that you struggle with, like pore size or texture problems or wrinkles or anything like that?
I just feel like my chin is always a little
Your
bit
chin? Okay.
porous,
So
but-
what we can do with microneedling, which is super cool, is we can stamp. So basically what that means is I can turn the settings up a little bit. I can have the needles go a little deeper, and I can kind of spot treat. So that's, and it's not painful just because the needles turn up. It isn't painful just because we're just quickly kind of tapping it onto your skin to just kind of make one little dot.
I have one more question.
Yeah.
When it comes to like, so you said it like kind of can correct wrinkles. Can
Uh-huh.
it prevent them? Like, is it a good preventative measure for people like in their 20s?
Mm-hmm. It's awesome
Like
for that.
me?
Like Jensen, just like Jensen. Jensen doesn't have a lot of wrinkles, but anytime that you can do any kind of treatment that helps with collagen production, that's going to help with your preventive. Obviously, I can't take away deep static wrinkles. That's, when you're looking more into like injections and things.
That's a drug for Botox.
Mm-hmm. But it totally can help soften them. It can help prevent them if you're young. It's my favorite skin treatment by far. Okay, so we're just going to stamp your chin just a tiny bit.
Okay.
And this you'll see a little bit more bleeding, but...
You ready, guys?
You ready?
Yeah.
How's that feel?
It's like weird.
Kind of funky, huh?
Mm-hmm.
But no painful? Not too painful at least? Okay. Can't
Should
feel it
think
too...
about it for a
I'm
minute.
not sure. I can turn it down if it is right on that bone.
Yeah,
It's
just
a
on
little...
the bone a little bit.
Okay, good job. Is there anywhere else?
No, I think that's pretty much where I'm more.
Okay, perfect. So, that's the full microneedling process.
Look at me.
You look
You
good.
look beautiful.
Okay, and then now we're going to go ahead and put a peel right on top. So like I said, she's really numbed, so she's not really going to feel this.
As far as like scheduling and costs and
Yes.
all that, do you want to walk through that?
Yeah, that's a good question. So, you can see any of our master estheticians for this procedure. It's just scheduled as a microneedling appointment. You can always come in for a free consult before to kind of discuss if this is exactly what you're looking for and things like that.
All the angles of my face.
I really am getting all the angles.
No, I love it. Get the lighting.
But basically, price-wise, I believe we start at $250, $240.
I want to say 4.
I think it's I'm pretty sure it's $250. I'll double check to make sure. I should have looked at that before. And then, like I said, sometimes with microneedling, these work better in series if you have specific goals in mind. If you're just looking for like something like Jensen, just wanting kind of a nice plump refresher for the season, one is awesome. If you're looking to really correct, that's when you're looking more at like a series where you're going to want to do like a series of 3 or 4. Okay, so we're going to put the chemical peel on Jensen. So we're doing a 5-berry peel. It's a Glymed peel that we carry here. It's a really good for lightening and brightening. It has some ascorbic acid in it, which is like vitamin C, basically, which will help with lightening and brightening the skin. And it's a good one. It has TCA in it, too, so she probably won't peel a whole lot. And that's another thing to note with microneedling. You probably won't peel a lot, but you may notice some flakiness. Downtime, she'll probably be red today, tomorrow, maybe the next day. You want to avoid makeup for about 48 hours. Just let your skin breathe.
That's okay. She's a natural beauty.
She is. How's that
I don't know
feel?
right now. Good?
Good?
I can't even feel it, yeah.
Okay, we'll just let it sit for a minute.
Yeah, your eyes are like blinding.
They look perfect.
Yeah.
Good, if that's the only thing that's
But
going
yeah.
for me right
Someone
now.
asked,
That red face
someone
looks
asked,
real good.
is this the vampire facial?
This is not the vampire facial. This is like the vampire facial. So the vampire facial is called PRP. So the difference between this and a vampire facial, this is just microneedling hyaluronic acid into the skin. To do the vampire facial, what they do is they draw your blood, they take your plasma, and they microneedle your plasma back into your skin. So we don't offer that here yet. Hopefully soon. Hopefully someday.
Within the next 2 years, probably.
Yes. But this is kind of the like little sister to it, you could call it.
Oh, cool.
Yeah. So we'll just let this sit,
long
and we
do
can
you
do
wait?
more layers. Typically you wait until she can't feel it anymore. Obviously she's numb, so she can't feel it. So rather than going off of her feeling, I'll just kind of watch the skin, and then after about a minute, we'll do another layer until we'll probably do a couple layers on her, and then she'll be good to go.
And then Jensen, how does your face feel?
Honestly, it's just numb.
Is it like sore? Is it...
Not sore. It's weird when I talk. I feel like I'm like talking weird, like you're at the dentist. But the only places really I felt it was like up at the hairline, and then when she just did that last little like what did you call it?
Oh, the stamping.
Bouncing. Oh, the stamping. That was the only thing where I felt a little bit. But honestly, the numbing stuff is great.
That's
I'm
awesome.
happy you put that on me.
Yes.
But it feels good. I mean, just super numb. Like I feel like I'm like talking like.
And then will it be sore after?
It shouldn't be. She may feel tight. It's like post-chemical feel, kind of where you'll feel that tightness. Maybe a little tender, but really not. Like I said, down days, she really, 48 hours, no makeup. Maybe a couple days of redness. Everybody's a little different. Some people bounce back immediately. But then, and like I said, she shouldn't peel. She should just flake a little bit. And then by the end of the week, you'll be back to normal, good to go. Cool. Fresh skin.
Oh, yeah.
Yeah.
Is there any possible side effect?
That's a good question. What do you think? As long as it's done right, you shouldn't. You know, you don't have to do a chemical peel on top. Like, there's things like that. We can modify it to make it more or less aggressive. And as long as your esthetician is watching your skin and making sure it's right for your skin, you should be good. There's not really anything you need to worry about.
And Jordyn's awesome, so I trust her.
But yeah.
Is there any other things that she has to take care of when she gets home? Like,
so we'll put some, after we're done with the chemical peel, we'll put a couple hydrating products on it just to kind of help rehydrate her skin. She needs to just keep active products off of it, so no retinols or anything on it tonight. Just kind of let it be. Wash it with just something like your Mega Purifying, or just something that doesn't have something that doesn't have a lot of active harsh ingredients in it.
Yeah.
And then just keeping it hydrated. You don't need to really exfoliate it for a couple days. Same as like after your chemical peels. If you do start flaking, you don't want to pull your skin off. Just let it be. Let it kind of do its thing. My favorite thing about microneedling is it looks so scary today, but really there's not a lot of downtime.
And I'm gonna be like posting probably just pictures for you guys, just like on my story of what like the healing process. I feel like that would be great for everyone to see.
Can she wear makeup?
She needs to avoid it. I mean, you can if you absolutely have to. It's not like if you had an event, you couldn't.
Okay.
But I always recommend if you can go 48 hours without makeup, that's what's really going to help you get awesome results. We don't want to clog up everything we just cleaned out.
I'm going to be hiding in my house for 48 hours.
hey, go to the grocery store and scare everyone.
I know. Do I look scary, guys?
No.
And once her chemical peel is done, we'll get all this blood off of you, so you'll look normal.
Great.
How many layers of the chemical peel are you going to do?
We'll probably do 2 or 3, dependent on if her skin can handle it and feels good about it. We don't want to be too aggressive, but get her a good result.
Somebody asked, does it hurt doing the procedure?
Did it hurt?
No, it didn't hurt. The only place where I felt a little tender was like around my hairline. And then when she did that last stamping method, just on my chin, I felt a little bit, but honestly, like the numbing stuff was awesome. I didn't feel anything on my cheeks. It probably looks really scary right now. I haven't seen myself, but it doesn't. Right now, I don't feel anything, which is great.
On a scale of 1 to 10, like what was
Scale of
the
1 to 10. I would say like a 4, honestly. It wasn't bad. It's like this weird, like, oh, and then you're good.
Yeah, makes
Kinda
your eyes
feeling.
water a tiny bit.
Yeah.
But
And then I just always close my eyes because I don't know why I just do that. But it wasn't bad at all. It was awesome.
Awesome.
It's good.
sweet.
Okay, well, we'll let you continue doing your peel.
Okay.
Do you want to
Sweet.
reiterate your name and what you do
Yeah,
here?
I'm
where we are?
Jordyn, and I am a master esthetician, and I do co-sculpting in the Orem location.
Book with her.
At Amara. At Amara.
That's
important.
Okay, thanks,
Yeah,
Jordyn.
thank you.
Bye, guys.